path to residency. For IMGs, ECFMG certification is required so you can get your diploma verification, exams, English proficiency. We talked about USMLE exams, of how important it is to get your score back from step 2 if you're a US medical student. If you are an IMG, either US IMG or IMG, how you stand out is having your step 3 done. Easy. I talked about applying for accommodations, that I have a workbook and you can look at it, and that I just heard from one of my friends this past week that allowed her to get board accommodation for her board exams, and now that accommodations workbook works for MCAT, USMLE, COMLEX, and now boards. Amazing. The biggest thing that I always like to say and remind is that it's okay if you fail, whether if that's fail a course, fail the USMLE, fail complex. You can get over it. You can match into residency. You can become a doctor because it's so important. I remember it's horrible. You take it personally, that failure, that you are a failure. No, you are not a failure. It's just a different part of your journey. And once you get to applying to residency, it's all about how you talk about that failure, what you learned from it. That's a whole nother topic. I do actually have a video on how to talk about red flags, but specifically for failures, do not mention your failure in your personal statement. You are not your failure. And I'm going to say that again. You are not your failure. Personal statement is about your journey. Tell your journey into medicine, into your specialty, and why you're going to be an awesome doctor for their program and beyond. And then sign up for my residency full complete package. One-to-one advising. I'm going to have the $50 off code that I know is worth like $800 because I'm giving you my personal number. I'm reviewing your app multiple times. I'm doing mock interviews with you, one-to-one advising, helping you with their match list, all that stuff. It's full complete package. This is a big thing that I had written down about IMGs. That is a big distinction. Clinical experience, observership versus externship. Observership means you observe like a pre-med student. You are sitting in a corner, zipped your lips, not saying a thing, and just looking. You can still do research with that. You can still get letter of recs. It's just not going to be meaningful. Externships, you're actually expressing hands-on experience. Big difference. That is what you want to aim for if you're an IMG, that you need that experience, externships, because these US clinical experiences, it's important. And I talk about this a lot when I give mock interviews to IMGs. You need to talk about the reason for the US clinical experience, the reason that they do that as a requirement is that it helps you get to know the US healthcare system. Because if you rotate, you will realize all the problems in the US healthcare system. And I feel like a lot of times during my mock interviews, I'm spending that time educating the people I'm doing the mock interview with so they know how to verbalize it, to show that they know what the problems of US healthcare system are. That's why those US clinical clerkships. It's for you to get to know the US healthcare system, get to know the US populations, get to know the EMR system. All these are reasons why it's required, and you have to verbalize that during your mock interviews and what you learned. We have to make sure you actually got what the purpose of it was. The US clinical experience, the other thing is learn if you can live in the US, if you can deal with our food, our weird mannerisms, if there's a part of the country that you're like, I love the South, I love Texas, I really love the East Coast, West Coast, Midwest. All of us are different accents, different environments, but something you need to know, especially if you're interviewing in Texas, you have to know why you love Texas. Same thing for the East Coast. They're all very different. I like to compare it just like every country is different in Europe. Every state, every regional state is very different in the US. So that's like an important thing of US clinical experience. Question: why is sleep an option for fellowship? So psychiatry goes to sleep fellowship and neurology goes to sleep fellowship, so that's one of the good combined programs that you can go from psych or neurology, because it is every single interview. When we do patients, we have to ask about their sleep. How is their sleep? And if you have mental health, it's always going to be bad, not good. Sleep is a fellowship to fully focus on understanding the sleep cycle, doing those sleep studies. There is tons of medications and it's super complicated once you really get into all the different types of sleep conditions. There's also neuropsych fellowship, addiction fellowship for family medicine, internal medicine, and psychiatry, residency, geriatric fellowship, palliative, consult liaison. If you really like internal medicine and psych, I've considered that too. I would almost do that one too. But there's something about trauma and helping families, and that's why I dual applied to family residency.